My name's Zara and I'm a counsellor and psychotherapist specialising in art and play therapy with primary age children and adolescents. So today I want to talk to you a little bit about attachment disorders in children. So there are 4 attachment styles, as they're called. There's a secure attachment style, an insecure avoidant attachment style, an insecure ambivalent attachment style, and a disorganised attachment style. So the term attachment is about the internal model a child has of how they can see people through the world, and that's based on their early experiences with their primary caregivers. So that's typically mum and dad or whoever might be looking after them. So a secure attachment happens when a child has an experience of their primary caregiver as being trustworthy, that they are responding well to that child's needs when they have them, that they're attentive, that they're attuned. And proximity to our caregiver is all about survival biologically. So when we have a good relationship with our caregivers, whoever they may be, then we have a good secure attachment, and that's how we go on to form healthy relationships, because ultimately we've got the experience that those relationships are rewarding. So an avoidant insecure attachment is when our attachment figure or caregiver has been rejecting, and often these children will go on to not seek proximity to people. They will avoid interaction, and they will often downplay their experiences and suppress their feelings because their experience so far has been that it's not worth trusting adults or forming those relationships because they won't be rewarding and nourishing. An anxious, insecure attachment happens when our caregivers have quite often been unreliable in their reaction to our early emotions when we're small, and as a result those children will very often continue to be anxious and again avoid forming those relationships because there's no real experience that it's safe and worthwhile to do so. In very rare situations you have a disorganised attachment, and disorganised attachment tends to happen when there is severe trauma, severe neglect, severe abuse, and very often caregivers that have their own mental health issues. And these children struggle the most because their caregiver, who keeps them alive and who they seek proximity to, is the source of their anxiety as well as their source of comfort. And that's why it's called disorganised, because it's very, very confusing. And these are the children that more often than not will go on to have severe mental health issues as well. So there's 2 main pathologies, and I use the term pathology to define what the diagnostic manual explains as a severe mental health condition based around attachment. So the first one is a reactive attachment disorder, and these children are very, very anxious and will typically avoid all social interaction and can be very withdrawn, very anxious, very quiet, tend not to make good eye contact, tend not to smile or engage in any way whatsoever. A disinhibited attachment disorder is the polar opposite of the reactive attachment disorder, in that these children will often be indifferent in who they attach to. So often these children will climb onto the lap of a stranger as much as they would go to a family member or somebody that they knew well. And with both of these pathologies, they can be worked through with therapy. That's the good thing. A therapist can often be the person that really restores that attachment structure that is consistent in the fact that they are always in the same place at the same time when they say that they're going to be, that they are always there completely for the child and ask nothing of them, but are there in order to facilitate their play and to reflect to them who they are and who they can be, and to offer them comfort and support when often they've not had that before. A lot of these disorders or insecure attachment styles come about from very early experiences, so babies that are left to cry, babies that are neglected, or sometimes simply having a really big family and not having needs met in the way we would ideally like that child to, can cause these things. What's really important to remember is that it's the experience and not necessarily the reality. So some children might experience their caregivers as being inattentive or unavailable to them, when actually that caregiver was working and looking after many children at the same time. So as a therapist, I never ever judge the parents or the caregivers for the way that child might turn out, because, as I say, often it's about experience and perception rather than what actually happened. Another common cause of these kind of disorders and attachment styles are children that are placed into the care system and children that are adopted. Any disruption to that connection to the first person that you meet in the world can cause a ripple effect that can lead to different attachment disorders. So if you think that your child might have an attachment disorder, or if you have a child that's come through the foster system or is adopted, then you can reach out to a therapist, or you can, of course, contact me. You can find me on the counselling directory, Zara Kadir, or you can find me on my website, www.choose-therapy.co.uk. There is always the possibility and the opportunity to restore these problems, but the sooner that you address them, the better.